We want to speak to three audiences today. The public, help us contain COVID-19, and I will say how in a minute. Healthcare professionals, in particular nurses, and our government. To the public, help us contain COVID-19 by simple measures that you have heard likely over and over and over. We need you. You're part of the solution. We need you to wash your hands always, before and after touching food, after using the washroom, after sneezing, coughing, or blowing your nose, after touching pets or handling garbage, after playing outdoors. RNAO posts today a very simple way for the public to see what they need to do in terms of protecting themselves and others, and also in terms of going to accurate sources of information. The public in a situation like this, when WHO is saying pandemic, will tend to panic, will tend to run to the fear. We are saying, let's keep calm, let's keep informed, and let's keep together. And for that, following the right sources of information is absolutely critical. To healthcare professionals, in particular to nurses, know that as we have done so far, where you have received daily updates with absolutely all the transparent information, you will continue to receive from me daily updates with all the transparent information that we are made available of. We will continue to be on your side and at your side as we did during SARS. Hopefully the outcomes in terms of at least people that die will be much less or none. To our government, first of all, I thank you on behalf of nurses for this time around listening to our voice. Nurses are feeling involved, nurses are feeling engaged, and nurses are feeling part of the solution. On that point though, 2 points that RNAO has been stressing to government over and over and over and over. We need to work on 2 fronts. One is to work to contain the virus as much as we can, or at the very least to delay the spread of the virus. However, at this point, it is the view of nurses that we can no longer say that the risk is low. At best, we can say that the risk is uncertain. Thus, while we continue to contain, or at the best, delay the rapid spread of COVID-19, we must move faster. And our government knows we have been asking for that. We must unveil and be ready to execute a full plan with an all-sector approach, including designated hospitals with off-site assessment centers, so that we don't clog emergency departments for people with current needs and for people with complications of COVID-19. And we must move much faster with launching virtual care. This is an issue that I have discussed at the very least for the last 2 weeks with government. The capacity in the province for virtual care at this point may out-surpass the need by the population if COVID-19 starts to go community-based. And for that, the time to launch virtual care is now. And I have sent to government plans for that with organizations in home care that are ready to move. Please give us the green light to move. We cannot try to have perfection. We need to move because it is our view that at this point we are working in borrowing time. Borrowed time. First we got the benefit from China that gave us time to be prepared. Now we have borrowed time of WHO saying it's a pandemic, and yet in Ontario it may feel like it's not a pandemic at this point. We cannot and should not wait until plans are perfect. Finally, I want to speak about solidarity, determination, and leadership. Rather than each fending for ourselves, this is an opportunity to come together. Connect with your neighbors. Do not hoard food or medications because this may lead to shortages, as we are already seeing in some aspects. Do not fit into the fear and speculation. Be sure you have a phone number to the lady who lives alone in your neighborhood, especially if she is older. Like when there is a power outage, we can help one another. The health of one is the health of all. Thank you. I will answer questions for any of you that have questions.
Are you hearing any concerns about nurses not getting enough masks?
So we have discussed the issue of masks, and we were privy of reviewing a new evidence-based guideline for the use of PPEs that is evidence-based, based on WHO and all the science that is available. Ontario has been using N95 for absolutely everything almost. That is not what the evidence is supporting. The evidence supports N95 for certain situations and surgical masks for other situations, and that is evidence-based. And what we asked this morning from government is that the guidelines for PPE in general, not only for nurses, but actually for the public. If this goes community spread, people will need to take care of people. What is the approach, evidence-based for that? We are asking that those guidelines be released as soon as possible.
This stood out. You said we can no longer say the risk is low. At best, we can say the risk is uncertain.
Yes.
Why do you make that declaration?
Let me say this to put things in context for you, and please not to panic the public, but to understand why we say it's uncertain. On February 26, Italy had about, if I'm not wrong, 76 cases. February 23rd, 76 cases. 2 weeks later, Italy has more than 9,000 people. Now, Italy did not behave the way that we are behaving in Ontario, of preparing the plans the way they should. But we need to learn from that aspect, because that's why we're saying we need to move a lot faster to unveil all the plans so the public is enrolled as part of the solution, and including a media campaign, which I believe the government will launch very soon, for the public to know how to protect themselves and others.
There's mention of a leaked document that reveals the province's, quote, watering down guidelines when it comes to personal protective equipment for frontline healthcare workers. What can you tell us about this document?
So that's the document, the PPE guidelines that I was referring a minute ago, and that we wrote to our members last night in terms of RNAO having reviewed the document. In our view of the Registered Nurses Association of Ontario, it is not a watering down of the protection. It is following the evidence for the use of personal protective equipment, both for health professionals and for persons of the public, in what situation to use what and when. So no, in our view, it's not watering down, and in fact, we're urging the province and everyone to put those guidelines out. Every day that we use more equipment that is not necessary, because the evidence does not require that equipment, is a day that we have less equipment for when we will need it.
We're seeing this in Vancouver, the virus spreading at long-term care homes. That's obviously very challenging for patients and for the healthcare workers. Is Ontario prepared for this virus to spread to long-term care, and what are you watching for there?
So let me talk first separate from COVID about long-term care, and then tell you how this becomes even more complex with COVID-19. Nursing homes in Ontario are the third staffed nursing homes in this country. Okay? Both in terms of skill mix, the type of people that work, and in terms of numbers of how nursing homes are staffed. So for me to say to anybody that we are all well prepared, we were not well prepared before COVID, and RNAO has been speaking for the last 10 years about this. So this is not only this government, it's also past government. And in fact, I came from a consultation this morning unrelated to COVID, where I said we were not prepared before, we are even less prepared now. So the government, the most important thing for the public to know about nursing homes today in the context of COVID-19 is let's keep COVID-19 outside of the nursing homes. That's our best advice. Let's make sure that active screening happens not only in nursing homes, but actually also in retirement homes. Let's make sure that not only if you have symptoms and have travel, but even if you have a cold and you have the flu, do not show up to visit your loved one in the nursing home. Of course, if you have nothing and have not traveled, we don't want to cause social isolation, right? So it's a balancing act. But where we have moved, and the province has moved with guidelines for active screening in nursing homes and also in retirement homes.
As it stands, do healthcare workers feel protected?
Healthcare workers, to compare to SARS, feel supported by the fact that this association and others are engaged at the highest levels of discussions with government on the plans. Healthcare workers also want to move much faster, and that's why we are asking for the government, don't wait until the plans for virtual care are perfect, don't wait until the plans for designated hospitals with off-site assessment centers are perfect. Let them move. There are several hospitals that I am aware are ready to move with their off-site assessment areas, which will then, is not only that will unclog emergency departments, it also, in ambulatory care, you don't use and you don't need to use the same type of equipment. You don't, the cleaning of the rooms in emergency departments, just picture what that takes in terms of time and in terms of resources. And then also, we're saying virtual care is a must, and many of our retired nurses, and we are going to give the exact numbers to government either tomorrow or the day after, retired nurses, nurses in mat leave, are ready to come back to support the virtual care from the comfort of their homes. Virtual care is something that we should be moving anyhow in the province. It's where the world is moving in terms of supporting people in their homes. So there is silver linings in all of this. Let's use the opportunity to fasten virtual care so it can serve us in the eventuality that COVID-19 goes community spread. And in any case, if not, we didn't waste time. We just are better ready to move to virtual care, which we should anyways.
From a
When do you
nursing
think
perspective.
when do you think they'll start off-site assessments? What's the process of getting that going?
So our understanding, RNAO has been asking for the designated hospitals the day that we learn about China, just so you know. And these things take time. But the reason we are saying we must move faster is because between things take time to moving, a lot of time has actually gone by. And now I am going to say again, we're working on borrowed time in the view of RNAO and in the assessment of RNAO. So there are several hospitals that are ready to move as we speak for both having off-site assessment areas, and all they need is the green light to do that. There are several home care agencies ready to move in addition to OTN, which is very important, Ontario Telemedicine Network. They're ready to move with other platforms or virtual care. It doesn't mean you move tomorrow and execute, but at least the public and the government will know here it is, ready to go. And that's what we need, the ready to go, not the planning phase.
From a nursing perspective, can you describe what it's like in hospitals, in ERs right now?
We hear every single day from colleagues. You need to understand that this update that goes to about 250,000 healthcare professionals by now, not only nurses, many other associations are using it, gives them a lot of reassurance that at least they're in the know, which was not the case on SARS. So that piece is better, communication is better. What they want to know is what's the plan. Tell us fully what's the plan, so we are ready. Nurses will always, 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 as always we have, been on the side of the public, regardless of what else is happening. Nurses always put the public ahead of themselves, and we learned that during SARS, and we know it will be the case here. What nurses want to know is what's the plan in home care, what's the plan in primary care, what's the plan in hospital care, where do we send people if they're calling telehealth and no one can answer because telehealth is overwhelmed, what's the plan if they call public health, etc., etc.
We're hearing more people calling for testing for COVID-19 to happen outside of Ontario's hospitals and ERs. What difference do you think that would make? And what do you think of the idea?
So there are two different models that we have briefly discussed, one more than the other with government. One is the one of virtual capacity. So basically to call people that are in self-isolation to see what's going on, etc. And that will free up a lot of the system. The other is for testing, right, which is different. Two models, the off-site from hospitals,
right.
Centers, which we are moving, the province is moving with them, we're just saying move now. And the second is the drive-through testing, which UK and others have done. And the government is looking into that, and if this goes community spread, I'm sure that the government will fasten that too, but that needs, the planning needs to happen now for that. And you need to have the resources, hence why we are also calling on retired nurses for the phone call piece. This is retired nurses, we wouldn't expose them, right, to, and for others to really come forward.
From a public health perspective, how do you think the province has responded to this outbreak?
I believe that there is a difference between saying no risk, low risk, to saying uncertain risk. And I believe, as I said, for sure at this point, when we had 4 cases, of course you can say low risk. But when the cases are more and more and more, right? And when the US, you know what's happening there, the time to say low risk in our view is over. The time to say uncertain risk is a must. And for that we need the public, right? Vacations are coming now with the break. We need to engage the public in where are you going to vacation, to be smart about where you go to vacation, what to do when you come back, etc. So we don't end up with
But do you have the tools and the resources that you need from the government to deal with this pandemic?
No pandemic is, no system in the world, in my view, is fully prepared for a pandemic. You don't have a system that is pandemic ready because it will be tremendously costly, right? And we need to be pragmatic about what's to other. Between that and now being ready when we are in borrowed time, it's a must. It's a must and it's possible. Singapore has done it. Singapore had, at the same time, February 23rd, 89 cases. Today they have 106, 106. In contrast, Italy had 76 cases, less than Singapore, and today they have more than 9,000. So, right, I want for Ontario to be Singapore, not Italy. And I think all Ontarians want the same. So let's come together as a community, let's fasten the plans, let's unveil the plans, and let's work as one team, the public, government, health professionals, the media, and all of us together. And by the way, the media, I think, has been fantastic, and I do want to say kudos. We have experienced no sensationalism in the media. We have experienced a tremendous level of responsible communications, and I want to give you the kudos for that, because that's hugely important, especially in a situation like this.
Is there anything else you'd like to add, maybe give a message to the nurses?
So to our nurses, first of all, I want to thank our nurses for their tremendous expertise and for the tremendous selflessness. I want to thank them for actually the many that unasked have already communicated with us at RNAO to say, we are ready to come back, we are ready to volunteer, we want to help. To our other health professionals, specifically doctors and others, I don't recall in the time of the history of RNAO that we work as close as now with our colleagues at the Ontario Medical Association. And for that, to our colleagues at the OMA, I want to say thank you. It is a fantastic partnership, and if anything is the silver lining of this public health crisis, is how well we're working as a community. Let's now bring the public on board so they feel part of the solution.